Hi, I'm Dr. Edward Krisiloff. I'm an orthopedic surgeon and I work at Somerset Medical Center. Well, we started the Joint Institute at Somerset Medical Center about a year ago, maybe a little bit longer. But we've been doing joints at Somerset for as long as I've been here, it's about 19 years. But in today's day and age, patients really want to move through the joint replacement process smoothly and not have issues, complications, pain level to be controlled, allowing them to do physical therapy right away. And so we started about a year ago the Institute, which is really geared toward making that process easier for the patient. And that includes preoperative evaluation where they come in and they are able to take classes with other patients who have been through the joint replacement process already, so it's educational, and they're able to prepare themselves to come in and then be ready, because now you come in the morning of surgery. Years ago, patients used to come in maybe 2 nights before and go through that process, but now we streamlined it. So they come in all ready to go. They have their surgery, and that very afternoon they're able to go to therapy and start either walking, bending joints, and it makes the process much smoother for them. And we're also able to get the patients to go home now, where before we had to send them all to rehab for prolonged periods of time. So it's really geared to making the process more efficient and able to move the patients through without complication. Yeah, patients often ask, what hospitals do we work at and why would we bring them to a specific hospital to do joint replacement? And I explained to them it really is based on a number of issues, and I think these issues are issues that we deal with very well here at Somerset. Number one is the Joint Institute and the entire process, pre-op, operative, and post-op care. But there are also some other issues. Anesthesia. People will often ask about who will my anesthesiologist be. And I think we have one of the stronger anesthesia groups in this area here at Somerset. I've also been here for 19 years, so I know the staff. We have good, strong nursing staff on the orthopedic floor. The floor is dedicated for orthopedics. We have specific rooms that are dedicated to joint replacement. We have good physical therapy. Also, we have had an award as far as our orthopedic care here at Somerset, our Health Grades Award. We're in the top 10% of hospitals across the country as far as our orthopedic care. So patients can be assured that we have quality services here at Somerset. My patient care philosophy, I think, can be summed up pretty much in having respect for the patient. I think I'm in practice with Dr. Stephen Schneider. It's just the two of us in our practice. And we're really very conservative in the people we decide to operate on. And when patients make a decision to have a joint replacement, it's a big decision. And they have to be counseled properly, because it is not always such an easy recovery. There's a lot of physical therapy involved and a lot of time and effort. And the patient has to be sure that they're ready to do that. And sometimes they'll come in the office and they're unsure, and we'll tell them, go home, think about it, talk to your family, talk to your employer, you may be out of work for a while. And so it really has to be a patient decision. So it's not driven by the number of cases that we do. It's really by the results that we get. And if we have patients who do well and are happy, then they'll tell their neighbor and we'll be busier, we'll do more cases, yes. But again, it's really respect for the patient and to operate really only when necessary. I think the most rewarding thing about orthopedic surgery is the immediacy of the results. And this is something that appealed to me even as a medical student, because I really wasn't sure what I was going to do in medical school. I even toyed with the idea of being a psychiatrist for a while. But then I rotated on the orthopedic service at Robert Wood Johnson Hospital. That's where I trained. And it was really the immediacy of the result. In other words, if a patient comes in with a fracture and we fix that fracture, the next day they're up in therapy and they're on a walker or on crutches and they're getting around. And a joint replacement patient may come in and they may be unable to walk or function on a daily basis, and we replace the joint and they have their life back. So it really, it's a lot of reward, a lot of feedback to the physician in that you're truly helping the patient, and you see those results very quickly. And that, I think, is unique to orthopedic surgery.